Okay, so you're an adult, you have high blood sugar, maybe high hemoglobin A1C, you've been told that you have type 2 diabetes. However, despite your best efforts for exercise and diet and maybe even medications, your blood sugar keeps rising. Well, maybe you don't have type 2 diabetes at all. Today we're talking about one of the most commonly missed diagnoses in diabetes care called LADA, or LADA. It stands for Latent Autoimmune Diabetes in adults. And very often, which we'll talk about, it's mistaken for type 2 diabetes. But unlike type 2 diabetes, LADA is actually an autoimmune condition. And it's affecting millions of adults in the USA, and they don't know it. So here's a crazy stat. The average time that it takes to correctly get diagnosed with LADA is 3 to 5 years. And in many cases, it's much longer than that. That's years of treating the wrong disease. So if your blood sugars aren't responding the way you think they should, despite your best efforts, take the next few minutes to watch this video, okay? It could change how you understand your diagnosis, it could change your treatment plan, it could change your future. So what exactly is this LADA, this LADA, this latent autoimmune diabetes in adults? Well, it's not like type 2 diabetes. This is an autoimmune disease where your immune system gradually starts attacking the insulin-producing beta cells in your pancreas. In fact, LADA meets the same diagnostic criteria as type 1 diabetes, especially for if you're testing positive for GAD65 antibodies, which we will talk about in this video. But unlike classical type 1 diabetes, LADA progresses much more slowly and it progresses as an adult. So you might still be making insulin for months or years, which is why it often gets misdiagnosed as type 2 diabetes at first. But eventually those cells that produce insulin, those beta cells in the pancreas, they wear out. And if you're on the wrong treatment plan, then you lose them even faster. So how do you know if you might have LADA? Well, here's some top sort of red flags that your type 2 diabetes diagnosis might not be what it seems. Number one, you're not very overweight. LADA patients often have like a lean to normal body type, and that's not the typical insulin resistance profile. Number two, you were diagnosed under the age of 50. Many people with LADA are in their 30s or 40s when it starts, which is earlier in general than type 2 cases, but not all the time. Number three, you or a close relative has other autoimmune conditions, right? Think like Hashimoto's, psoriasis, celiac disease, rheumatoid arthritis. LADA often appears alongside other autoimmune conditions. Number four, you had a good response to medications and diet and exercise at first, but then things kind of stalled out and your blood sugar kept going up. That's the classic pattern. Some early improvement followed by rising blood sugars again, even though you haven't changed a thing. Number five, your insulin or C-peptide levels are lower than what you would expect for your blood sugar levels, right? This mismatch is often one of the biggest diagnostic clues. So to better understand the differences between type 1, type 2, and LADA, I've made a chart. So let's go through the differences and similarities so that you can help sort of figure out your path on this whole journey. So let's start with blood sugar. In all three types, blood sugar is high, but with different patterns. In type 2, it usually creeps up slowly over time. LADA can do the same, but with much more fluctuation. And in type 1, blood sugar often spikes very high, very fast, sometimes to even very dangerous territory. Now, the cause of type 2 diabetes is primarily insulin resistance. Your body still makes insulin, but you can't use it well, right? In LADA, it's a mix where the root cause is autoimmune. Your immune system is, slowly attacking those insulin-producing beta cells in the pancreas. But some patients also have insulin resistance, whereas type 1 is purely autoimmune with a much faster and more aggressive destruction of those beta cells. Now, like I said earlier, body type can be a subtle clue. In type 2 diabetes, patients are often overweight or they carry more abdominal fat. It's a hallmark of insulin resistance. But in LADA, body type varies. Many people are lean or normal weight, which can totally throw off doctors who are expecting sort of a typical type 2 presentation. And in type 1, patients are often very thin, especially around the time of their diagnosis, due to rapid muscle and fat breakdown from insulin deficiency. Now, when we look at insulin resistance, it's very high in type 2 diabetes, and that's the main problem. But in LADA, it's usually low to moderate, and some patients have insulin resistance, but many don't. Whereas in type 1 diabetes, insulin resistance is minimal or absent at their diagnosis. The issue isn't insulin resistance, it's a total lack of insulin, since the reason for type 1 diabetes is because your body has attacked the beta cells of the pancreas, and so then your body is just incapable of making insulin at all. When we look at autoantibodies like GAD65, that's what really clues us into autoimmunity. In type 2, they're not present. In LADA, they're positive, sometimes one, sometimes multiple, but that's part of what defines it. Whereas in type 1, autoantibodies are usually highly positive, especially at diagnosis, and often multiple types are found. Now, when it comes to insulin testing or C-peptide testing, those two are actually very closely related. This is where testing gets really revealing. In type 2, insulin and C-peptide levels are high because the body is pumping out insulin to overcome the resistance. Now, in LADA, insulin and C-peptide levels are lower than what you would expect when you compare it to how high your blood sugar is. And in type 1, they're very low or even undetectable because the beta cells have been destroyed. Now, another clue comes from how quickly someone ends up needing insulin. In type 2, the progression is very slow, years or often decades, or maybe not even at all. But in LADA, it's gradual. It's not as fast as type 1, but much faster than the typical type 2. And in type 1, insulin is needed almost immediately. Without it, life-threatening complications can certainly occur. Now, to make things even more complicated, LADA isn't really a single uniform disease either. Some people with LADA are more autoimmune, right? They shift on this more autoimmune side with strong antibodies and very low insulin production because their pancreas is getting destroyed. Whereas others lean more towards the insulin resistance end of the spectrum with higher C-peptide levels and maybe some extra weight. And that's why researchers now see LADA as a sort of bridge between type 1 and type 2 diabetes, not just in symptoms, but in genetics, inflammation, antibody levels, and insulin output. So why does catching LADA early even matter at all? After all, it's autoimmune, right? What are you going to do? Well, first of all, early diagnosis avoids the wrong treatment. LADA often gets misdiagnosed as type 2, and those patients are often put on medications like sulfonylureas. But those don't work well with LADA. In fact, sulfonylureas like glipizide and glyburide have been shown to actually accelerate the destruction of the beta cells in the pancreas, where your insulin is produced. Second, earlier detection results in earlier initiation of insulin therapy, which can certainly help maintain your metabolic control and may actually slow the decline of beta cell function. So it may delay complete insulin dependence. And third, it gives you clarity, right? Knowing that it's autoimmune gives people a better understanding of what's happening and that they aren't like failing at managing type 2 diabetes. So knowing what's happening is certainly important. So now I want to give you an outline of how you can start sort of piecing this whole diagnosis together. Start with a fasting insulin or C-peptide test. I mean, in my opinion, for whatever that's worth, fasting insulin should be part of routine labs anyway. Fasting insulin and C-peptides tell you how much insulin your pancreas is still making. And C-peptide, by the way, if you've never heard of it, it's kind of a byproduct made when your body produces insulin naturally. And it's a little bit more stable than insulin in the blood. And it's widely used in clinical practice. Then check triglyceride levels. Triglycerides are often elevated in type 2 diabetes because insulin drives fat storage. But in LADA, with lower insulin output, your triglycerides are often low to normal, despite the fact that you have high blood sugar. So if you see this combination of high blood sugar, low to normal fasting insulin or C-peptide, and triglycerides are lower than expected given your high blood sugar, that's your signal to start getting a GAD65 antibody test. And if that's positive, you don't have type 2 diabetes. You have LADA, latent autoimmune diabetes of adults. And the treatment needs to change. So in type 2 diabetes, insulin, C-peptide, and triglyceride levels are usually high, and in LADA, they're usually low, despite the fact that you still have very high blood sugar. So you may be watching this video thinking, LADA, never heard of it. And you have to realize that LADA is not rare. The American Diabetes Association says that around 10% of people who think they have diabetes actually have LADA, but many other studies, they put that rate much higher. Some populations showing rates as high as 25% in people under 35 and up to 50% in some select cohorts. And here's the part that's hard to believe. A 2020 Brazilian study found a median 5-year delay in correctly diagnosing LADA, and one patient went 37 years before finding out that it was autoimmune. They say, in the LADA group, there was a larger interval between the onset of diabetes and the establishment of the autoimmune etiology. Median of 5 years, 60 months that is, with a maximum of 37 years. That's years of the wrong treatment and unnecessary beta cell loss. And here's the biggest problem. Even though LADA patients often have fewer traditional metabolic risk factors than those with type 2 diabetes, they have the same or even higher risk of death, cardiovascular disease, and diabetic complications like retinopathy. And that's from a 2023 meta-analysis published in Diabetes Therapy. So treating LADA like type 2 diabetes isn't just ineffective, it can be dangerous. So what can you do about it? Well, if your blood sugar keeps climbing and the meds aren't working and your diet's not working and exercise isn't working, and if your diagnosis never really felt right, don't wait. Ask for a fasting insulin or fasting C-peptide test. Ask for a GAD65 antibody test and compare your blood sugar to your triglycerides. These tests are not expensive, right? One of them, the fasting insulin test, when I order it on my patients, it's $13 for them to pay out of pocket for that. So maybe you don't need more metformin. Maybe you just need a more accurate diagnosis. Millions of people have latent autoimmune diabetes in adults and they don't know it. So if this video helped you or raised questions about your diagnosis, share it with someone you care about. Early detection means better treatment and fewer complications, right? It's a shot at protecting the beta cells that you still have.